So the phase 3 transform study was a study that was a phase 3 randomized study in patients with high risk relapsed refractory large B-cell lymphoma who had not responded to upfront R chemo or relapsed within the first year of receipt of upfront chemotherapy. Transform study compared Lisocabtagene maraleucel versus standard of care, which was 2 cycles of salvage chemo, and in responders an auto-transplant. The net of that study was that liso-cel was statistically significant and superior compared to standard of care, thus making liso-cel the new standard of care in patients with high-risk relapsed refractory large B-cell lymphoma. This abstract was analyzing outcome prediction based on ctDNA in terms of the assessment at baseline and then an assessment of the log fold reduction and reversion on both of these arms. On the transform study, baseline ctDNA was collected on both of these arms in about 2/3 of patients and then serially monitored at intervals of 15 days, 43 days, 1 month, 3 months, and onwards. In the pooled analysis, it was important to note that a low baseline ctDNA correlated with a higher event-free survival. Similarly, a low ctDNA and MRD negativity also corroborated with high complete response rates. With individual arms, it was important to note that in both of these arms, if patients achieved MRD negativity at any of the time points that MRD was assessed, it did translate into longer event-free survival. However, in terms of clinical activity, it was seen, just as was shown with liso-cel superiority over standard of care, patients with liso-cel ended up having higher evidence of MRD negativity compared to standard of care. With regards to MRD negative folks in both of these arms, liso-cel as well as standard of care, on the standard of care arm, in patients who achieved MRD negativity, the MRD negativity was not durable. And this basically translates into the clinical benefit that we see with liso-cel because MRD negativity is durable. With regards to MRD reversion rates, we saw more MRD reversions to MRD positivity on the standard of care arm, again outlining the better clinical impact of liso-cel over standard of care. So the net of this study that was done with ctDNA assessment, we determined that baseline ctDNA, baseline MRD, as well as tracking of ctDNA, and in patients with MRD negativity tend to achieve better outcomes. Liso-cel tends to have longer, durable MRD negativity with less reversion to positivity. So at this point in time, in conclusion, we do state that the ctDNA is certainly an outcome predictor for CAR-T on the transform study.